Cristina, could you please introduce yourself again, a little bit about yourself?
Okay, well, my name is Cristina Sanchez. I'm a professor of biochemistry at Complutense University in Madrid, Spain. And I have been working, studying the anti-tumor effects of cannabinoids for the last 15 years.
Uh-huh. Okay, well, thanks, Cristina, for that, and thanks for the opportunity to do this interview. It's fantastic. And just to tell the listeners that we've just talked for about a half an hour, and technology failed us, and the recording didn't actually record. So my apologies for that, Cristina, but we'll give it another attempt. And thanks so much for your patience.
It's okay.
We did have a great conversation, didn't we, prior to this this technical error. So, Cristina, what were we talking about? What was the
Cannabinoids, probably, and cancer?
Probably we were probably talking about cannabinoids and cancer. And we did start to talk about the Dennis Hill interview and the things, the actual issues that you didn't agree with Dennis's interview. And I'm sure Dennis would be really interested in that as well.
Okay.
So
well, the first one was regarding the amount of THC and CBD that a cancer patient has to take in order to cure his or her cancer. Well, first of all, we don't know if cannabinoids cure cancer because we don't have clinical control studies saying that. We know that they work as anti-tumoral agents in preclinical models of cancer, and we have a lot of anecdotal reports from people saying that they have cured their cancers with cannabinoids. But from the medical community perspective, we don't have that evidence yet that cannabinoids cure cancer. But going back to Dennis's point regarding the ratio of THC and CBD that one has to take to cure a cancer, I wouldn't say that a 1:1 ratio is the need. I would say that each individual, each patient needs a particular ratio of cannabinoids, or at least that's what we have seen in our preclinical models of cancer. Not only us, but the rest of the research groups that are working on this field. What we see is that some types of tumors, for instance, glioblastoma, brain tumors, in these cases, more THC works better than a 1:1 ratio. On the other hand, in breast cancer, which is the type of cancer in which I work, we have seen that more CBD works better than a 1:1 ratio. So I would say that, and this is the case for other medicine, other anti-cancer medicines, each patient is a different situation, is a different clinical challenge. So I wouldn't say that a 1:1 ratio would work for everyone, or that it would be the best combination for everyone.
So you're saying each patient is different, or each type of cancer?
I would say each patient is different. Cancer, we use the same word cancer to define one pathology that is tremendously heterogeneous. Breast cancer has nothing to do with a prostate tumor, and within breast cancer, which is my specialty, we have so many different types that we don't treat the same way. We have different medicines, we have different prognosis, we have different therapeutic approaches. So I know it's hard to assume from the patient perspective, but each patient is a different world in therapeutic terms. So probably we can narrow the ratios when we define tumor types, but within tumor types, we will have to see each patient in particular.
Okay, and what was the second point that you didn't necessarily agree with?
Yeah, the second point was in regards of the prominent role of cannabinoid receptors in the response to cannabinoids. I mean, if I understood correctly, Dennis was saying that the responsiveness of cancer cells to cannabinoids depended on the presence of cannabinoid receptors. So in other words, if you have cannabinoid receptors in a cell, you can kill that cell with cannabinoids. But that is not 100% precise. We have some cases in which the response to cannabinoids depends on the presence of cannabinoid receptors. For example, in breast cancer, we know that breast cancer have a lot of CB1 and CB2 receptors, and that non-breast tissue has no expression, no CB2 expression. So probably in this case, that's the answer to why cancer cells die and why non-cancerous cells don't die in response to cannabinoids. But on the other hand, we have, for example, neuroblastomas. Neuroblastomas are tumors that are produced from your neurons. They become tumoral and they create tumors. These cells express CB1 receptors. So you treat these cells with THC and you kill them. But our neurons, our healthy neurons, they do have CB1 receptors as well. And when you treat neurons with THC, you don't kill that cells. And this is telling you that not everything is in the absence of cannabinoid receptors. That's not the key question. Mm-hmm. That's not the key to why cancer cells die in response to cannabinoid receptors and non-cancerous cells do not.
Okay.
I don't know if was it clear?
It was pretty clear. I was trying to focus more on the fact that the recorder is still recording somewhat. So I'm looking I'm looking at that, and I figure I'll try to make sense of it later on. I was thinking of THC is the ligand for the
if
CB1
you see
receptor.
That, I'm sorry, but if you think that something is not clear enough, just let me know and I will try to rephrase it and make it clearer for you, please.
I think you're explaining yourself very well, Cristina. Now, while we're on the subject of Dennis, I have a couple of questions that Dennis wanted to ask you, which I've emailed you before. So I'm just going to see if I can find them in my notes here. Question 1. We know that the CBD inhibits the mental effects of THC, but does this action also inhibit any of the therapeutic capabilities of THC? Do you know the mechanism of how CBD inhibits the mental effects of THC? Now, in saying that, and I'll add to that, so if you can remember that question, I also had a patient from Colorado saying, I am 71 days. His name's Steve Justino. Mm-hmm. And he says, I'm 71 days into a modified Phoenix Tears protocol in an effort to cure my Gleason 7 prostate cancer. I have built my dose tolerance up to CBD suppository 325 milligrams and of CBD and 16.5 milligrams of THC in the morning and again in the afternoon, then a TH suppository 350 milligrams of THC in the evening. All oils are decarboxylated. I am doing the modified Phoenix Tears suppository rather than oils and in doses as above rather than using strictly 1-to-1 ratio, which you were talking about before, during the day to maintain a function at work. That being said, I'm a little concerned about the fact that I get no psychoactive effect from the evening 350 milligrams of THC suppository either. Whereas 140 milligrams of THC from the same strain taken orally produces an extreme hallucinogenic psychotropic effect. I know that the THC is metabolized to 11-hydroxy-THC in the liver after oral consumption, and that 11-hydroxy-THC is more potent than THC. Therefore, it makes sense to me that cannabis ingested via suppository is weaker clinically than oral, since it is missing the first pass in the liver to convert. And finally, my question: does the lack of psychotropic effect from the THC suppository mean that there is a lack of therapeutic effect as well? A long question.
No, not at all.
Oh,
yeah, interesting, very interesting question.
Good.
No,
good.
I mean, if he's 100% sure that that's the amount of THC his medicines have, I think he's doing the right thing. And the profile that oral consumption and suppositories have in terms of psychoactivity, and which is a reflection of what is going on in your blood, is completely different. So what is happening to him is completely normal. When you ingest cannabinoids orally, you have like a very slow increase in your THC levels in the blood, very slow, that is kept up during a long time, and then it goes down. When you use suppositories, the increase is still slow, but it goes not as high as the oral route, and it's maintained a little bit longer. So, in fact, that's a very good route of administration. It has some social, I don't know how to say this. I mean, people usually don't like to use suppositories, yes. But it's actually a very good route of administration because the increase is slow and it's the high levels are maintained very, very long. So that's what you want when you're taking a medicine that you want to last in your body for a long time. So I think he's using the right routes of administrations, and apparently, I mean, he shouldn't be worried that he's not getting the therapeutic effects because the levels of THC in his blood will be maintained for a long time.
Well, that's a fantastic answer, very comprehensive, and I'm sure. And Steve Justino also has a blog which he is writing on an almost daily basis and telling people his results. So
that's very interesting.
It is. So
yeah. And especially because he's controlling the amount of THC and CBD that he's taking. So it's very useful information.
It is useful information. So going back to Dennis's question, we know that CBD inhibits the mental effects of THC, but does this action also inhibit any of the therapeutic capabilities of THC? Do you know the mechanism of how the CBD inhibits the mental effects of THC? A bit different.
Well, THC and CBD are very good friends. They get along very well together, but their mechanism of action is different. So CBD does not bind to cannabinoid receptors. THC does bind to cannabinoid receptors. Some people say that CBD binds to CB1, but it doesn't do it in the same place where THC is bound. So the effects are completely different. So in some cases, THC and CBD has opposite effects. For example, on anxiety, certain doses of THC have anxiety-like effects, and CBD can counteract these effects because it has the opposite action. And when you combine them both, you can have the therapeutic effect of THC and some of the therapeutic effects of CBD. So they work very well together. This is the entourage effect, not only of combining THC and CBD, but the other compounds that are present in the plant. And they work very well together. It's like an orchestra. I mean, probably you like the sound of violin. It sounds really nice. It's a very beautiful sound. But if you combine a violin with a cello, it will probably sound better. And if you have the whole orchestra, what you feel is completely different, because they are touching different parts of your brain probably, and when they play together, the whole brain is activated.
Okay.
And with the compounds of the plant, with THC, CBD, and the other cannabinoids that are present in the plant, the terpenes that are present in the plant, the other bunch of compounds that are present in the plant, what you have is a multi-target effect.
So this is the entourage effect, isn't it?
Exactly.
Now, this is. I'm going to jump in here, Cristina, because you were talking about the trials with Sativex, I think you said. Now,
Sativex.
Now, this is a bit of concern for me because I like organic, naturally grown food, and And I believe that if the cannabis oil in a pure organic essential oil does the job, why do we need to synthesize it and take different parts out of it? Why can't we have the whole goodness of this pure God-given product?
I fully agree with you, but Sativex is not made as you say. Sativex is a botanical drug extract, so they produce the compound from the plant. So it's not that they synthesize the THC, the CBD, and put them together. Right. So it's an extraction from the plant. But I fully agree with you. I mean, we need a medicine that produces reproducible effects. So if you're a patient, a cancer patient or a pain patient, you don't want an oil that one day works in a way because it has certain amount of THC and CBD, and then you change the batch, and next week you have to retest everything again because it doesn't have the same proportion of THC and CBD. That's what I mean when I say that we need a standardized medicine, something that you know which effect is going to produce on you, because you know the amount of THC and the amount of CBD. But you can have that from Sativex, which is produced by a huge pharma company, but you can also have that from a smaller company that makes the rigorous controls and tells you what's in the medicine.
I would think if you had a certain strain of cannabis and you grew it in certain conditions, you could pretty well guarantee that it was going to be a certain quality of THC CBD.
Well, I would be happier if, besides doing the same thing all over again, you have your the tests done, because you never know. I mean, you never know. Well, and for sure, I mean, you can do that for your own. But if you're going to give that to other patients, you should have your tests done.